Pfizer and BioNTech say a booster jab of their coronavirus vaccine promises to be an effective defense against the new Omicron variant, the companies said after conducting a small study into the efficacy of the jab. 3 doses provide a similar level of antibodies against Omicron to that of 2 doses against other variants. The World Health Organization earlier said vaccines should still work against severe Omicron cases. Researchers around the world are piecing together data about Omicron. It is the most heavily mutated version of the coronavirus thus far. In a statement on Wednesday, Pfizer Chief Executive Albert Bourla said protection against the variant will be improved with a 3rd dose of the jab. However, Pfizer and BioNTech have noted that the results are preliminary and said that they will continue to collect data and evaluate real-world effectiveness. Now, they added that they are developing an Omicron-specific vaccine which will be ready for delivery within 100 days, pending regulatory approval. Both the Pfizer-BioNTech research and a new South African study has found that the vaccine might result in far fewer neutralizing antibodies against Omicron than against the original COVID strain. Now, to discuss this latest report on the new Omicron variant and what Pfizer and BioNTech have said about protection with booster shots, we are joined now by Professor Adrian Puren. He is Acting Executive Director of the National Institute for Communicable Diseases. Professor, a very good evening to you and thank you so much for speaking to us. So let's look at the sample size of the study. Admittedly, they say it is still early stages. They're trying to understand, the scientists, as much as they can of Omicron. But can we trust this, that Pfizer and BioNTech, a 3rd booster, would protect against Omicron and especially severe symptoms?
Yes, so in addition to that particular study, there has been a study from South Africa as well that has been released. Again, it's not peer-reviewed, but it also has a small number of cases. And I think there was another institution that also looked at a small number of individuals. Again, that was on Twitter feed. But nevertheless, the 2 studies certainly do show that in the presence of Omicron, that there is a reduction of what we call neutralizing antibodies. And so that is of concern in some ways, but it also indicates that there is some level of protection that could still be present. But I think also what is really critical is that we need to understand the T-cell responses. In particular, will this prevent severe disease, which I think is what our main focus is, at least in South Africa. Mm-hmm. So coming back to your specific question, so it's likely that, and again, the numbers are small, that the boosters may certainly assist. We do know that boosters will improve antibody levels or even pre-existent infection followed by vaccine and booster will certainly enhance antibody response. So that may well hold. But we need to have more data to really confirm.
So, Professor Puren, let me jump in on that point exactly, because there had been some studies or some scientists who said that Omicron actually can avoid pre-existing protection if you've had Delta or other variants of COVID-19. So what should we believe now? If we're told that it's partial protection, does that mean that could possibly be true, that Omicron is able to sidestep previous immunity?
Yeah, so in other words, what I think is being said is that, yes, there is some evasion by Omicron of pre-existent immunity, but that it's not completely, I think, absent. In other words, there's still a level of protection that there may well be, which I think is a good thing. I think that, again, the observations in terms of the mutations and the actual real-world science, I think, is always that bridging that gap to ensure that what we have observed are those mutations really allowing full escape? But we know that from these particular limited experiments, that in fact it's not full escape at all. I think additionally, I think what will be important is to really get some of the epidemiological data, clinical data, to really enhance or reinforce these particular observations.
So tell us, when a study like this goes through peer review, and it's found that, for instance, that one has 40, what do they say, is it 40% or 40 times less potent against Omicron? What are you looking for? What are the markers? And for us who are laymen who just don't understand what are the factors involved in these studies, what should we be looking out for?
Yeah, so I think it's really the experimental design. What have they used? So again, are these standard methods? In other words, have they used methods that everybody else is using? So in order for us to compare one set of experimental results with the other, and I think that's very difficult under the current circumstances. There are attempts to standardize that, but I think it's important for one to know, is there a sufficient number of individuals that have been evaluated to really come up with a firm conclusion, or do we need more data? It's likely that these initial data certainly give us an inkling of that, but it needs to be expanded. And again, are these results comparable to other results in order for us to come up with further conclusions? So I think those are the types of questions that we should be asking, of course.
I mean, you spoke about the role of T cells, and I'm wondering if Pfizer and BioNTech are saying that they could be working on an Omicron targeted vaccine. Would it be designed with that in mind? And what happens then if there's another variant which is able to mutate even faster than Omicron?
Yeah, so for as long as we do not get extensive vaccine coverage, yes, that is going to be the possibility that we're going to be faced with variants that may be very similar, if not more so than the current. I think we thought Delta was the epitome, but now we've got Omicron. So yes, it's important for us to take into consideration. So they will take those mutations into account. But I think there are even greater attempts to come up with a more universal vaccine, in other words. So it could well be that we could see boosting happening, let's say on an annual basis, for example, in order to either cope with and or to ensure that our immune responses.
Prof, I'll give you just a moment to just put on your earpiece, but I think this is what worries a lot of people who are called anti-vaxxers, that we are putting in all of these foreign objects in our body. We don't know what the effects are long term. Scientists also admit that they don't know the various properties of the disease, and even while they're developing vaccines to help shield us against future infections, you speak about the evolution of it. So getting a booster shot perhaps every year, could it also become at some point, because we're being told that COVID-19 is going to be with us for a very long time. Could it come to a point where we're receiving a booster shot every 2 years or even monthly?
Well, I would hope not monthly, but I would at least annually, if not biannually at least. And that's what we do with, for example, influenza in South Africa. As you know, each year, based on the formulations, we in fact do receive boosters in order to ensure our immune response is reactive to the influenza virus. And remember, even with influenza, the so-called vaccine efficacy is much lower than what we've seen with these particular vaccines that are currently very potent. So I think we misunderestimate if we think that these vaccines are not effective. Because when you look at flu, it's not as effective in terms of the vaccine. So these are really effective vaccines. I think there will be improvements on these vaccines. There will be approaches to universal vaccines. So I think, and we will understand more about this particular virus. I think, yes, it does catch us off guard, but I think now that we are aware that, for example, variants are important, that we're aware that there are multiple mutations, that these mutations need to be seen in context of not just looking at the mutations, but also looking at laboratory results, looking at the epidemiology, looking at the clinical picture. All these elements need to be triangulated for us to better understand how to approach this and to adapt to this particular virus.
What I've also find interesting is the symptoms themselves evolve, don't they? We're being told that Omicron, although can be more easily transmissible, but the symptoms themselves have changed, whereas the loss of smell and taste have been very much attached to COVID-19, at least the presence of the virus. It seems that for Omicron, there's also been some change in that. So tell us, what should you be looking out for? We used to be told fatigue, headaches, but now we're told runny noses. If it's during winter, it could possibly be a cold. If the numbers of COVID are higher, then it's possibly COVID. So what should we know about Omicron and its symptoms now?
Yeah, so again, when we looked at Delta, I think there were these comments that there may be different signs and symptoms. But my view is that they probably are a core set of symptoms, in other words, such as the sore throat, the breathing, the rising temperature. Those are going to still be the loss of smell and so forth. These are all still going to be key symptoms. So I think there's always been a constellation or a range of symptoms. And I think once you have that range of symptoms, it could either, because we know that there is also influenza in circulation currently, not to the same extent as in the so-called actual real flu seasons, but I think we just need to have that suspicion, in other words, that if we have this range of symptoms, that it's important, therefore, and they are affecting our well-being, especially our breathing, for example, that we do need to seek medical attention and seek testing as well.
And perhaps I should point to those figures that are coming out of the BRICS countries showing that the crude death rate that is said to be connected to COVID-19 is of concern. Is it getting any better if we're saying Omicron doesn't have as severe symptoms as Delta, for instance? Could we see that number drop?
Yes, I think that's why I think it's really critical. I think that the numbers will certainly increase quite dramatically. But again, the consideration, though, is what is reflected in terms of our wards. If that increase in numbers leads to our system being overwhelmed, then that's going to be of concern. But yes, I think it's really seeing that disjunction between what we're seeing at our hospitals. If those numbers do not increase dramatically and our mortality does not increase dramatically, then I think that's a good sign around at least Omicron in terms of its pathogenicity. But I must express a concern that if these numbers really increase very dramatically, that we can still overwhelm our health hospital systems, that can still lead to an increase in mortality.
And particularly those with comorbidities, because this has always been the warning, hasn't it?
Absolutely. So again, if you're in a particular age category, 50 and above, without comorbidities, my sense is, again, to really encourage people to vaccinate. It is really of concern that when we look at these particular age groups and we look at a province like Gauteng, if I understood the figures correctly, then I think only 1 in 3 persons in Gauteng have been fully vaccinated, but we can check on that. And overall in South Africa, again, about 40% of South Africans are fully vaccinated. So I think, in the context of ensuring that we manage this particular virus, reduce the possibilities of variants arising that are of concern, vaccination is one of our major routes out of this particular pandemic.
Thank you so much for speaking to us, Professor Adrian Puren. He is Acting Executive Director of the National Institute for Communicable Diseases now.